starting now. We will be using the chat box feature. If anybody has any questions, they can certainly use the chat box. Or if you're not comfortable using the chat box, at an appropriate time near the end, or if Andy asks, you can come off mute and you can ask him your question directly. I will be moderating the chat box. So if there's questions that come up, Andy, I will try and help you get along with them. I have enabled screen sharing, so you are good to go. Thank you so much.
Thank you very much. How's everyone doing? The world's looking a lot more optimistic. The world's opening up finally. It's been a long couple of years for everybody, so this is really exciting. I'm glad to finally speak with you. Hopefully soon we'll be able to speak in person in the not too distant future, for sure. Absolutely. So let me just make sure I can screen share here. And let me just get like some thumbs up from people if they can see my screen. Can you see my screen? Yep. Sounds good. And we'll go right to the slideshow here. So this is an immense opportunity for topics. Over-the-counter medications, there's thousands of them, right? So what I've done is we'll leave lots of question and answer sections at the end. I've kind of designed some did you know kind of facts, and then I'm trying to make it a little more engaging, some of like interesting facts about over-the-counter meds that people may not know. And then I'm going to leave lots of time for question and answer at the end, because I know that people, especially on over-the-counter meds, love this. So it's great to have a big topic about that. But we'll start, first of all, on the safety and the efficacy on this. And I have a few questions throughout to test your knowledge, to see if you guys know what your knowledge is like about over-the-counter meds. So perfect. So yeah, my name's Andy. I am, if you haven't been to one of the talks before that we've done in the past, I'm a certified geriatric pharmacist and president of the Health Depot. We're now a part of Green Shield Canada, our pharmacy, which is a nonprofit organization founded by pharmacists. So we're now, in all essence, really a nonprofit pharmacy, which is exciting with some of the clinical work we're doing going forward, which is really exciting how we're changing, helping to change and improve people's health and healthcare. So first of all, let's define kind of over-the-counter topics, right? You have when you take medications, this is a very important slide to understand that whether or not it's prescriptions, if it's an over-the-counter medication or a herbal medication, they all act the same in our body. They all bind to a receptor in our body, and they have an effect, right? They can have side effects. All drugs, all of them are, right? Prescription or herbal, over-the-counter, they're drugs, and they change our body the way it normally processes. It has some sort of an effect. They all can be harmful if they're not used wisely. And when used together, they can all interact and cause more problems, right? Depending on what they are. So that's why it's very important that you tell your pharmacist or whoever's in your doctor and whoever in charge of your care, your circle of care, doctors and pharmacists, very important to have as part of that. You let them know what over-the-counter meds, vitamins, and herbal products you're taking, because they all can have a positive and also a negative effect. And that's the big thing that we like to help educate people with our Empowering Your Health webinar series, is that there's a pro to every kind of thing we put in our body for meds, and there's also a con. And you got to kind of weigh them out to see what might be the right for you. So a couple of things on over-the-counter meds. You might notice these numbers that are on the front of bottles. There's an MPN number, a DIN number, or a DIN-HM number, right? These are important things to know. NPN means natural health product number, okay? That's a lot of minerals, vitamins, herbal, probiotics, things like omega-3s, amino acids, and stuff like that will have an MPN number, right? Different classification, different testing, and different proof that are behind these things. Drug identification number as well. That's what you'd see like on a Tylenol. So vitamin C would have an NPN number, whereas Tylenol, which is a drug, has more rigorous testing. It has a drug identification number. We'll discuss in the next slide a little bit more the differences. And then a DIN-HN just stands for a drug identification number for homeopathic medicine, okay? It's kind of its unique own class. And we'll discuss that a little bit more coming up. So here's the natural health product dilemma. In the United States, historically, and it's still today, it is not regulated whatsoever, the natural health product market in the United States. They don't have to provide any kind of proof of efficacy or purity of their product whatsoever. So what they have on the side of their bottle and what's in it doesn't have to be in it, right? So they can list, so it's the supplement list that's on there. may be wrong. There may be things even in it that in their compound that's not even listed on their bottle. That's the problem. In Canada, in recent years, they're improving this, thank God, right? So for Canada, we're starting to try to provide more rigorous testing that, they're not allowed to do what they've been doing in the States. So there is some emerging testing that they do through Health Canada, but it's not as rigorous as you do with the drug identification number, right? The same kind of testing, if it has a DIN, so that like Tylenol, Advil, if it has a drug in it, even sunscreen, right, has a drug, so it has to have a DIN. That means that it's been tested by Health Canada in clinical trials, and they know all that what's in there. There's, exactly within a margin of error, and they've done safety testing on it, whereas a lot of the herbals don't have to do that. It's getting better in Canada. We still got a long ways to go, though, right? And that's the big difference between an NPN number, natural health product number, and a DIN, is the DIN has a lot more safety and efficacy and studies done on it. So you know what you're getting. So a little dose of truth about herbals, right? As we kind of mentioned before, a lot of people think that, herbal means natural, which is healthier, right? And we just want to reiterate the fact that herbal products are drugs, right? It does not mean it's safer for you. And sometimes they have a lot more drug interactions and side effects than actual medications do, right? And because of the natural health product status, they don't have to do a lot of safety and efficacy testing in the past, right? And sometimes, yes, there are ones that can work for you for sure, that can be helpful, right? But then sometimes if they're not the most ideal for you, taking them can delay a potentially more effective therapy, right? You need to look at what's the best thing for you. After all, about 25% of all prescription drugs are actually obtained from natural and botanical sources originally. And sometimes they find that and then they try to tweak the structure of it to make it even work longer or better, right? That's where a lot of medications actually first started. I don't know if you knew this, like aspirin, for instance, started from First Nations individuals figured this out, that it came from a bark tree, right? And they actually were able to get it out in a tea and use it thousands of years ago, right? And that's where aspirin came from, right? And then they just take that science and they've improved it a little bit over time. So now I'm going to go talk briefly about the top herbals. So I just said, be careful about herbals, but now like the top used herbals, what is the scientific proof behind some of these, right? Because some of them are very good. Some actually might be even better than, we'll go into a couple of them, better than some of the over-the-counter versions that have a DIN, right? So we'll go into that. And then I'm sure there's gonna be lots of questions at the end. So please write them down and you can barrage me at the end with lots of questions, because there's thousands of different drugs, there's lots, right? But it's just, unfortunately, so there's a lot in herbal that don't have scientific proof. So I'm not allowed to, I know what they claim. And as you saw that, because the natural health products, that for years and years and years, they haven't had to prove anything. But thankfully in Canada, they're not allowed to make outrageous claims anymore that saying it will cure cancer when it doesn't, right? So they're starting to improve that finally over time. So without further ado, one of the top ones is Echinacea, usually from the root. Very weak evidence that it helps to prevent colds, right? Reducing the risk of colds. There's no evidence, so that's weak evidence that it can help a little bit, so you'd have to take it all the time. No evidence that it helps with the cold once you catch it, right? So a lot of people in the past will take a lot of Echinacea. It's like, oh, you got a cold, you need to take like 20 drops of Echinacea 3 times a day, right? It doesn't help with that. There's no proof of that once you've caught the cold, right? Very, very weak evidence and inconsistent evidence whether or not it can prevent it. And the idea is you'd have to take it through the whole cold season anyways. And the problem is with a lot of these safety studies too, when they do studies for herbals, they're very short-term studies and not long-term. So you don't know even the safety of taking them long-term. Ginseng, which is a lot of times ginseng panax, a lot of people use, that's cold effects, right? So that's what cold effects, the secret ingredient in cold effects. And it shows very, very lack of evidence that it actually helps any kind of beneficial in humans. They did have one study they did where they suggested it helps your second or third, if you take it every single day in a high dose, it can help reduce the incidence of your second or third cold of the year by a little bit amount, right? It was like, so they had to really stretch, not your first cold, but in order to try to find some sort of analogy there, but there's not much evidence for that either. It does have it does boost people's, some of these substances have been found if you're lacking. Usually, here's the issue with all vitamins and minerals. I'll give you the ins and outs of this. So we can go talk, there's lots of vitamins out there, right? Usually vitamins, if you're deficient in them, what your body needs, that's when the problem happens. Taking too much of that vitamin, if your body doesn't use that vitamin or mineral, it flushes it out the toilet, right? It just gets rid of it, right? So it's not actually helping improve your health. It's the deficiency in those minerals and vitamins that can often cause issues, right? You know, whether or not, you know, like scurvy, if you don't have enough vitamin C, right? But you have to be very deficient in vitamin C to get scurvy. But if you take too much of it, your body just gets it out the toilet, right? And sometimes there can be issues if you take too much of vitamins. We can talk about that coming up more in the Q&A. But like, yeah, they've even found in studies, if you take way too much vitamin D, like you're taking 10,000 vitamin D every single day, it can actually cause some issues with like dizziness and like issues like that, believe it or not, if you take way too much of it. Whereas 1,000 to 2,000 international units of vitamin D is perfect, right? Right in that wheelhouse. You don't want to overdo it. So it's just like eating. You want to eat in moderation. You don't want to overeat things because it'll cause problems. The same thing with like vitamins and minerals. But really when it comes down to it, your body only needs, you only need to take what your body needs. Taking too much of it, it won't help you, and only potentially, if you way overdo it, cause problems. Anyways, so back to it. Next one, St. John's wort. These are like, that's one of the ones that has a lot of documented proof that it actually can help with mild depression, right? Not severe depression, mild depression. The issue with it, though, it's one of those drugs that what it does, it speeds up your liver. Huge. Most of your drugs, if you're not aware, get processed and chopped up into little byproducts in your liver. All of them go through these liver enzymes. And what these ones do, a lot of meds, when you have drug interactions, will usually slow your liver down. So that means instead of your normal dose being here, it'll actually make it stick around longer in your body, and then you'll have side effects and issues. And that's what things like, you know, if you've been told not to take grapefruit juice, that's what it does. It slows your liver down. A lot of certain prescription drugs will also do that. St. John's wort is one of the few substances out there, like alcohol, that actually speeds your liver up, right? So then certain medications you might need at a certain dose will actually go down in level, and you need a higher dose. So that's why, and it does that to a lot of your liver enzymes, certain ones. So then it can have a big effect on a lot of your other medications. So because of that and the other side effects it has, it's very limited its use. There's a lot of better, safer alternatives in the prescription market if you have anxiety or depression that help out a lot more, right? Now on to one that is getting a lot more attention lately, turmeric. The main ingredient, curcumin, right? Curcumin. It's a mouthful there, curcumin. But it's studies actually suggest that it's very useful in helping arthritic pain and inflammation, right? As other NSAIDs, which are non-steroidal anti-inflammatory drugs. Ibuprofen, which is Advil, is one of the biggest ones, right? Then Aleve or naproxen being the other. But it might even be safer than those NSAIDs, believe it or not, the pills, because it can actually be useful and treat to help protect against ulcers. Instead of like Advil causes ulcers, you know, it actually might be able to help prevent them, right? It doesn't have that same effect on thinning your mucus layer in your stomach that can cause an ulcer. So it can help with anti-inflammatory, like the level that Advil does, ibuprofen, but might be better for you overall, right? Which is amazing. So score one for the herbals, right? You know, a situation here that actually is a little bit better, right? But then taking it in a palatable form, now you got to figure that out, right? The dosage is unique for everyone. Powder, because sometimes it's not the greatest. So taking it in a capsule form, they can get through your stomach. You know, figuring that out, right, is like what you need to work on next, right? And the right doses for you. But yeah, very, very, and a lot more research is coming out of it, of other beneficial effects that turmeric can have, right? So that's a very good one. Ginger, forever known as the ones, I remember when I was a kid, even getting like flat ginger ale, right? To help if you have like a upset stomach as a little child or something like that. My mom, like, get rid of the bubbles, right? And you know, help out for your, which is actually true. Often used for nausea. Ginger, like true. You know, obviously the ginger ale is not really the real ginger ale. It used to be, I guess, now. But ginger does help with nausea from pregnancy, chemotherapy, and, you know, sometimes people just get from operations like the anesthetics, right, that use in operations. Very useful for that. But also believe there's research coming out that it can actually help with preventing clot formation right? But it definitely needs more studies, long-term studies for the safety of taking ginger for that purpose long-term, right? As I said, a lot of times with natural health products and herbals, they lack long-term studies to know what the effects long-term are. But there's a lot of suggestion that, yeah, ginger might even be good for that. Chamomile, a lot of people using that for chamomile tea, right? It can actually, believe it or not, help with inflammation, all right? And it also helps with, inflammation obviously is related to menstrual pain. So that's kind of the same point there, but also sleep. But believe it or not, whether or not a chamomile tea helps you or hurts you is kind of, it actually can cause insomnia too, right? It can actually cause people to stay up, right? So it's kind of unsure about even the sleep quality that it gives you, right? Long-term, they need to look into that more. Certain sleep meds don't help your sleep quality. One of our past talks we did about that. We need to do a lot more research on that. Like, what is the effect on your REM sleep and your deep sleep that chamomile has, right? And some people, like if you've noticed, you tried chamomile and it didn't help, and you might have actually stayed awake. You might be one of those individuals that it actually causes you to stay awake, right? So you just have to case by case basis. But there's, again, more studies needed. Another one that's been going around, this is one of those old white tales, that ginkgo biloba helps you with your memory. Doesn't whatsoever. No proof whatsoever. It does have a lot of antioxidants in it, right? Which is great. But there's no beneficial proof ever about ginkgo biloba, unfortunately, and no studies have ever shown any positive effect. And it does have some side effects like headaches and stuff. So that's one that is unfortunately more of a wives' tale. There's not much attached to ginkgo biloba benefits. Elderberry is a newer one. That's one that's getting a lot more research people because they're thinking that it has very good antiviral activity in the body. And there's a few studies out there that suggest that it might actually help reduce your flu, the duration of you having the flu, right? But the problem is they're not the very most conclusive and long studies. They need to do the more designed well and a bit larger sample size, right? But that's a good potential, and there's getting a lot of excitement, a lot of Google searches on this. But be careful too, the raw fruit cannot be eaten. You have to cook it. Or it can be very toxic and cause like nausea, vomiting, and diarrhea. So it has to be very well cooked. And there's some stories of people adding raw elderberry into some of their formulations, and it causes some very nasty side effects because of that in the past. So that's a little more careful. And one of the last ones we see a lot of questions on. These are the most common ones we hear about when patients come to talk to us in the pharmacy about over-the-counter meds and herbals, particularly the herbal section. Valerian root has very weak evidence as a sleep aid. A lot of Eastern European, my wife's Polish, very popular over in Europe to look into valerian root a little more. It has some beneficials for sleep, but there is side effects to it, right? And drug interactions, right? So which lower its usefulness compared to some of the alternatives, right? And a lot more studies needs to be done on long-term use of valerian root as well, okay? So that's the top ones. So now getting a little more interactive. So hopefully I didn't put everyone to sleep with the herbals, right? But now we're gonna do a little over-the-counter quiz that we're gonna go through some topics and I'll ask and see how well you know your over-the-counter meds. Getting more into some of the DINs and stuff like that. So without further ado, let's see. Do you think weight loss supplements, you can do this either in chat, maybe easier or whatever, are weight loss supplements effective? Let's see here. How do I pull up the chat? Does everyone know how to do that? Or do you guys think are weight loss supplements effective? There's huge sections of them. Most pharmacies have almost a whole aisle for weight loss supplements. And it seems like everyone's unanimous. And that is correct. They are not. And I am one of the biggest supporters of these, right? Anyone comes up to my pharmacy when I worked in pharmacy in the past that would have a weight loss section, I would say, do not go down there. Because I'll tell you why. Because, yeah, a lot of them, Skinny Bean Coffee, Dr. Oz got brought in front of Congress in the States because even for that question, he said, I believe Skinny Bean Coffee told people it helps you lose weight, right? And when they grilled him in front of Congress and said, there's no proof of any of these things doing beneficial, he says, and his response in Congress was over and over again, I believe it does, instead of it, he has proof. So they couldn't paste him, he got in front of that. They don't do anything. Some of them will have mild ingredients that can help you go to the washroom more. get fluid out. So you can lose a little bit of water weight, right? But then dehydrate you a little bit, but then you gain it right back. There's no substance that can cause you, your weight often is fat cells, very, very densely energy packed. If it got you to melt away your body fats, imagine what it's doing to the rest of your body, right? It would probably melt away your heart and you'd have a heart attack. And like, there's nothing natural that does that, okay? And the reason why they all these substances say that you must diet and exercise while taking them, right? What do you think helps you lose the weight? The diet and the exercise. And that's why I'm a very anti-supporter of it, because if you are dieting and exercise and you lost the weight, I want, like, as a healthcare provider, you to know that you're in control of your own body weight, right? And your own health, right? I don't want you to say it's the pill that did that, right? That's internal locus of control versus external locus of control. And that's why I do not think anyone should have these. And the most likely people who are willing to spend hundreds of dollars on weight loss supplements over the counter, they're the ones who are, if they're willing to spend hundreds of dollars, they've bought into the diet and exercise idea, right? Because they're going to do that because they want to make them work. But I want them as a healthcare provider, them to know that they did that all themselves, that pill had no help whatsoever. And these things are definitely not effective. And so that's the main thing. So what does help you with your weight loss is, there's a lot of diets out there, right? And I'm not a big fan of any of these either. The whole new generation, the millennials, are making this worse, right? Everyone wants, I call them young TikTokuals, right? Because they want, if you can't tell them something in 30 seconds, you can't tell them anything, right? It's like their attention spans got worse and worse, and everything has to be so easy. It's like, yeah, you need to eat just fat, nothing else in your whole diet except fat. Or you need to just eat herbal, nothing but vegetables, nothing else in your diet. Or you just need to eat no carbs whatsoever, the Atkins diet, just protein. That's all cool concepts, but it's all about balance. Your body, the only energy your brain uses for brain power is glucose, is carbohydrates. If you totally do not take carbohydrates, you're starving your brain, and your brain's not going to be working as well, right? It's all about portion control and combining them. And the best diet I've ever seen is actually the one recommended for diabetics. It combines all the notions together. And if you, that's what this picture here is. If you can get your plate into quadrants, the whole idea is half your plate should be greens and vegetables, healthy foods, right? And fiber and all that kind of stuff. A quarter of your portion should be carbs and a quarter in protein, right? That's well balanced. That's going to help you lose weight control. But it's all about making sure you don't have a big heaping plate of spaghetti. Yes, that's not healthy, right? It's like it's like making sure it's well balanced, and then your body calories in to calories out. If there's a deficit, you will lose weight. If there's a surplus, you will gain weight, right? And what's really important too is the notion of that diet and exercise together, okay? Because dieting, your body will break up and use, if you're starving yourself, your muscle cells before your fat cells, believe it or not, right? You'll lose muscle mass before you lose your fats. And what happens with that is we have something called a basal metabolic rate. And that just means that, and it's based on how much muscles you have. At rest, if you have a lot of muscle, you're burning this much energy every single day to maintain your muscles, right? And if you starve yourself, what happens is your body eats your muscles, you lower that basal metabolic rate. Now you're not, your body is not burning as much fuel to power your muscles, right? Because now it's less. So the same amount of calories, if you eat the same amount of meals as you did before, you're going to actually have more actual weight you might gain because you're not actually burning as much. So that's why, believe it or not, they often say you just don't go for a walk or a run. Sometimes you light weights, right? If you do aquafit, weights in the pool, because you're building your muscle, which is actually making more muscle, which then makes it so you burn more calories at rest. So anyways, get a little, that's my phys ed background too, coming out. I did phys ed and health education as one of my degrees in my undergrad. But yeah, so that's what you need to do as well. And educating people on that is what's important. And it's all you doing it, not those god-awful supplements. I think they should be banned from all stores. I think they're horrible. And I think they should take them out because it actually makes people feel like the pill's doing it when it's all themselves, right? So anyhow, so that's like my little message on that one. Next question. Is homeopathy effective? What is your answer? Let me see. Homeopathy. What else? What do other people think? Anyone else? Got some yes? So this was a trick one. I'm impressed by some of the answers here. So homeopathy, oh, someone said no, Ken. So here's the thing. It's not for what you think. This is a trick question. It is effective, but not for the reason you think. Homeopathy is placebo effect, which is a real effect, okay? It's like taking sugar water and you believing that it actually works, right? It's the power of positive thinking. Here's a little science. Like I found this slide. I love it. So if you believe something's going to be effective and good, your body releases endorphins and like these little signal molecules in your brain, right? And dopamine and stuff like that. So this is also why people who believe they're going to be cured of cancer, right? And they're very positive outlook on things, they're way more likely to actually beat cancer than someone who's down in the dumps and thinks they're gone, right? Your body actually it's really weird, but your body, like positive outlook actually has such a drastic effect on your own signal molecules that actually can cause healing and getting better. So yes, homeopathy does work because you believe it's working, right? So that's the thing. So having told you that, I probably shouldn't have told you that, but that's the secret, right? So it's like using that if you take this. So the idea with a child is often you see 0 to 9 months. This is a substance for 0 to 9 months. You're giving your child something that they believe is going to help them with their cold, right? Instead of giving them a drug that might cause side effects and stuff. So this will not harm your child, but they believe they're taking medicine to help them out. And that's why homeopathy is almost exclusively given to kids, because they believe that they're taking medicine. It tastes like some of the other medicine they take, right? And then their symptoms magically get better because they believe they took medicine that's going to help them. And that's what homeopathy works as. It's actually the science behind it. I don't know if you ever heard it. It was kind of ridiculous. I felt so bad. There's a homeopathy rep that came to our pharmacy class in undergrad with 240 science nerd pharmacists to be, right? And they had to kind of explain the science of how it actually works. And they tried to tell us this mirror image in water and that less is more. And it was just, the more they said, they got contradicted them. It was kind of interesting to hear someone who actually was trying to make science out of it. But really, it's just a fancy way of trying to, the problem is here, the catch-22 I'll share with you is, if you know it's a placebo and you take it, the placebo doesn't work, right? So that's why it's reserved for kids, and adults have to keep it quiet. This is also the idea that believe it or not, back a while ago, for ear infections or colds, and people were demanding to get antibiotics, right? Thinking they need an antibiotic, they need a pill to help treat a cold. That's not good for antibiotic stewardship. That can create resistant organisms to antibiotics, so they don't work as well. So for a bit, they were thinking of making antibiotic pill that was a placebo pill that, the doctor could write a prescription for, the pharmacist could give a patient, and then them thinking they'd have an antibiotic, but it's really a sugar pill. You can imagine the ethics of that if then that patient did end up having an infection, and the doctor had it wrong, and they thought they got an antibiotic, and all they got was a sugar pill. So obviously they didn't go ahead and do it, but that was the idea behind it, is that the idea of placebo effect is a clinically significant real effect, the power to positive thinking. That's what homeopathy is about. So, and then here's a good example of that. The placebo effect, right? Shows in certain classes and conditions can improve therapeutic effects up to 40%, the power of positive thinking. Great for depression, great for pain, right? Your body releases dopamine and things like that, and pain signals that can block pain out if you're positive about it, believe it or not, right? But obviously, when it comes down to the real science, obviously, placebo for contraception kind of sucks because it actually doesn't help. Power of positive thinking can't stop you having a baby, right? So that's kind of the idea behind it, right? And it's really seems prettier, but it's still just, right? So next question for people. Sleep easy pills, nighttime or medications with PM, are they good for your sleep? What do you guys think? No with the sad face. Can be. So I'm wondering how many of the people here attended my sleep talk earlier. So pretty good here, and you're right. So the answer is no. They can short term, so it's a little bit of a trick question, and a couple of the answers caught that. They can be effective for 3 days to 1 week, but they're not good for your sleep quality is the issue, right? So they're very, very anticholinergic. So as I shared here, in the other talk, Gravol is an antihistamine, has that kind of effect. It's dimenhydrinate. Benadryl, which is sleep easy pills, is all diphenhydramine, which is Benadryl, rebranded. And then a lot of the other ones in PM and whatnot is doxylamine, which is just another antihistamine as well. They cause a lot of side effects, dry eyes, dry mouth. A lot of prescription meds cause these things, and this just are the worst of the worst ones. On top of it, and over a long period of time, they can ruin your sleep quality. They ruin your rapid eye movements, right? Which is your dream sleep, which is you use for your memory, your cognition, making new memories, and your cognitive thought. And so actually, the more anticholinergic meds you have, it leads you towards, believe it or not, having more likelihood of getting dementia long term, right? Because it starves your brain of the good quality sleep that allows you to make new memories and memory consolidation, as well as recall, right? So, and they have hangover, drowsy effects that go into the next day. And so, yeah, they're on this list. I shared this in the sleep talk, but they're on a score of 1 to 3 of the worst drugs that cause this. They're all 3s, all these antihistamines. And so they're often in cold supplementations. If they have a PM or a nighttime in it, it means that, yeah, they can help you out short term, and they might help you fall asleep when you have a cold if you're having a tough time falling asleep, but they shouldn't be used longer than that because of these long-term effects, right? So that's the main thing. All right. Now getting into ones that can help you though, don't finish it off. Talk about this in sleep one. Melatonin, a lot more beneficial, right? A lot more safe. But the whole point is it's meant, high doses that are in pharmacies of 3, 5, or 10 milligrams of melatonin are meant for people that have drastic changes to their sleep schedule they need to redo. So that's people who have jet lag, if they came from the other side of the world, shift work, days to nights, right? Or something called delayed sleep-wake phase disorder, right? So, but the whole point is that those doses are meant for you taking short-term, 5 to 7 days and stopping. If you're going to take it more long-term, because you have low melatonin, as a lot of us do as we get older, you normally only need 0.6 to 0.7 milligrams of melatonin. So there's 1 milligram tablets available out there. I think we have it on our store too. Even half of those pills is what you need on a daily basis, then, right? A low dose. Taking too much can actually cause you to have too much rapid eye movement sleep, right? All about the balance. Too much of a good thing is not a good thing, right? So, but it's generally used 2 to 3 hours before bedtime, right? And they do cause you to have more dreams, right? Rapid eye movement sleep. And if you have too high a dose, that's a sign that, your dose might be a little too high. That's where you can get those really crazy, freaky, vivid dreams. Some people love that, but it can be kind of spooky, like real life dreams. If you have too high of a dose for too long, is because it's encouraging your rapid eye movement sleep. Something else over the counter, tryptophan in turkey, as we all know, that's amino acid. That actually helps you to sleep as well. And it's because it's a precursor to your body making melatonin. Your body converts tryptophan into melatonin, which makes you sleepy, right? It's in a lot of foods, right? Poultry, eggs, as you know, obviously turkey is the most concentrated, but it's soys, nuts, bananas, things like that. And then, but then because sleep's so important, there's really 2 of the go-to meds. If you take them the right way, trazodone and mirtazapine, they're prescription drugs though. You just have to make sure you're taking them the right way. Trazodone has to be taken 3 to 4 hours before bedtime, where people take them at bedtime and they say they don't work. You have to take them every day, 3 to 4 hours before bedtime for them to work well, okay? Not at bedtime. Whereas mirtazapine can be taken an hour before bedtime, but then that one has to be only a low dose. The higher the dose you take, the more it actually wakes you up, because only low doses bind to a receptor in your body that makes you sleepy, So that's up to maximum 7.5 milligrams. The one that's covered by the government plan is 30 milligrams. So the maximum dose you can take of mirtazapine is a quarter tablet. Anything more than that will bind to the wake-up hormone, if you remember the sleep lecture, which was serotonin. You'll start having more of that, and it'll keep you awake. So that's the two things that I noticed that people with those prescription drugs don't do the best, is they don't take it the right way, and they think it's ineffective. You just have to, there's specific rules on how you do that. So then, next question. What is safer for long-term pain, Tylenol or Advil? What do you guys think? Tylenol or Advil? There we go. We got a couple answers. We've got 2 Tylenols. Advil, none. Tylenol, neither. Neither. Yeah. Everyone's like expecting tricks now, right? So, but it actually, believe it or not, out of those 2, Tylenol, and it depends. You're right. It's one of those other ones, depends as well. But for the most time, Tylenol is the safest. But you have to, the things you need to be worried about are how much Tylenol sources you're having a day, and it depends on your liver function, right? Because it can be very toxic for your liver. As we age, the most you want to have is 3,000 milligrams from all sources, right? Extra strength Tylenol pills are 500 milligrams, and arthritis pills are 650 milligrams in each pill. Regular strengths are 325. And there's Tylenol in almost every over-the-counter cold supplement or stuff like that. You have to be careful. And it's like from all sources, and it's very toxic for your liver. And if you drink alcohol, it's even worse. So it can make each Tylenol pill 8 to 9 times more toxic for your liver. So if you drink a lot of alcohol, then it's like instead of taking 1 Tylenol pill, like you just swallowed 9 pills, right? Or 8 or 9 pills. You have to be careful because your body makes a much more toxic form when you have a lot of alcohol that you consume. Okay, but high blood pressure can't have Advil. Yes, that's one of the main reason why Advil or any other anti-inflammatory, NSAID, right? The short form they call NSAID, non-steroidal anti-inflammatory. So an anti-inflammatory drug is because it blocks your body's ability to make prostaglandins, right? That is in your stomach lining, right? In your stomach. So then it eats away at that. And this is why we talk curcumin, right? That, it doesn't do that. But, if you eat away at that mucus layer, you can get an ulcer. We also have these prostaglandins protecting all of our arteries. This is also why sometimes they say if you take NSAIDs for too long, it can cause more risk of heart disease and stuff. It's because you have a protective coating in your arteries. You can also eat that protective coating to make your arteries a little more sticky, right? And then also it can cause your blood pressure to increase over time, right? Reducing, it can affect your kidneys. It's a lot of the other things it can do, but it can increase your blood pressure over time. And no matter how many other blood pressure pills you take, it's really that it's reducing the flow back to your kidneys, which then cause your body to release these factors that cause your blood pressure to go up. And because of that, it's really, you need to come off the anti-inflammatory for your blood pressure to improve sometimes. So it's just a lot more risky that NSAIDs and so Advil, Aleve and stuff like that are more short-term for big inflammatory pain, right? But only in short-term spurts. So Tylenol is a little bit better, but there's different instances when you would use, you wouldn't even want to use Tylenol. You'd want to use other sources. And as I got another question coming up a little bit later. But here's another one. Is docusate sodium, known as Soflax, good for and effective for constipation? What do you guys think? This is one that many people may not be. Yeah, stool softeners. No idea. So this one's commonly given by doctors. Often, this would be one of the drugs, like the little shiny, translucent pill. It's like a little red bead, right? Almost like a little ruby that doctors give also often a lot of times, assigned, especially if you're on a narcotic or something like that, doctors will prescribe this. So docusate sodium is not effective for constipation, right? it's another one of those placebo effects, and we don't know why. All the studies show it's just as effective as sugar water, right? So why is it given? Because positive, this is one that placebo effect doesn't really help you unconstipate yourself, though, does it, right? It's like you're getting given something. Power of positive thinking cannot help pass that bowel as well, right? So I'm kind of confused why. Like the concept behind it is like was like a good sell back in the day when Soflax and companies like that were selling it to doctors. It just never had the proof, and when they've done follow-up studies, showed that it doesn't help. What does help, though, for effective constipation treatment is depending on if it's regular constipation or narcotic constipation, two completely separate treatments, right? And this is what we need to pay attention to. So if it's regular constipation, you're not taking a narcotic, and it's just because there's a lot of things that can happen that can cause constipation as we age. Your muscles become less tight, so things become a little bit more open, and then dehydration, not taking as much fluid, a lot of different things. But so the need to take more fiber is very important, right? So regular constipation, that's where it's going to be Metamucil, more fiber in your diet, a lot of berries, a lot of fruit have lots of fiber, vegetables, absolutely. And then PEG 3350 helps as well, which is Restorelax. That's a little more strong. It's more of an osmotic one, right? But generally, when you have regular constipation, it's best to not take stimulant laxatives. That would be like bisacodyl, right? Is one, or Senecot. Not very well used and not very effective for regular constipation. At the same time, using stimulant laxatives when you don't need to can cause something called lazy colon, which means that you cannot even, it's very tough to have a bowel movement if your body gets used to that, unless you take one of those medications in a higher dose. So that's why it's best to avoid those stimulant laxatives like Senecot if you have regular constipation. Having said that, when you have narcotic constipation, what actually happens is narcotics, any kind of them, bind in your gut to, there's like 3 different receptors that, trying to want to confuse things too much, but you have a mu receptor for narcotics in your gut that if it binds to, it paralyzes your gut so it doesn't move, right? So it comes to a screeching stop, right? Well, stimulant laxatives like Senecot are the go-to for that because it'll bind in your gut and get your gut moving again. Whereas if you took a bulk agent like Metamucil, right, and your gut's not moving, now you have this like a branch structure, okay, a fiber. That's what fiber does. It's like the branch structure that each of the branches will attach to a water molecule. And the idea is it's supposed to trap that water molecule in your gut to soften it, to allow it to help with your bowels a little bit more. And it always takes like a day or two for that to really help out for constipation. But if your gut's not moving and you have all this like fibered kind of structured in your gut, then all it makes is actually can make your bowel even more impacted and more hard, because if it's not moving, it might bind to water, but then your body will reabsorb the water over time and actually make you even more constipated. So if you're taking narcotic constipation, it's like a must that you take really the stimulant laxative Senecot if you have any issues with your bowels, okay? And so that's the 2 little difference between the 2, but usually Metamucil is the go-to for regular constipation until if you're have to take a narcotic, codeine, morphine, or something like that, then you need to switch it up, and that's when you use Senecot. Okay. So that's so you guys did really, really well with those questions. I just wanted to test you on those. Those are some of the trickier ones that kind of work backwards to what people are thinking, And this is an example of why, you have questions like this and you're not sure, talk to your pharmacist, right? Always available to talk, and they have a lot of knowledge on these things, right? So now I'm just going to go through a little bit quicker some interesting facts. Muscle relaxants don't actually relax your muscles, okay? They're called that. Methocarbamol or cyclobenzaprine are 2 muscle relaxants. Methocarbamol is in Robaxacet or Robaxisol or Robax Platinum, right? That's the muscle relaxant in, and cyclobenzaprine is a prescription, right? They actually help. They don't. If you have a tense muscle, they don't untense the muscle. They cause you to be drowsy, and they cause a little bit of painkilling action, right? So it helps you fall asleep, right? And because they cause a side effect of dizzy and drowsiness, right? So that's what they're using it for. And it also helps with pain, right? So it's an add-on to your Tylenol or Advil or whatever is the other part of those muscle relaxants, right? For instance, a Robaxacet, right? Or Robaxisol. But yeah, it doesn't actually, and because of that too, it can drop your blood pressure too over time. But so that's why you don't double up on the muscle relaxants ever. You just take that one amount because it can make you very drowsy and tired, right? So that's what is kind of combining both, but it actually doesn't actually relax the muscle. Topical anesthetics don't actually block pain, but instead work as the usually counter irritant. And what do I mean by that is, so they either, a lot of these topical or over-the-counter meds like capsaicin, right? It creates a burning sensation. Menthol creates a cooling sensation, right? They overload your pain receptors. So if you have an elbow that's hurting, like you pulled a muscle here and like wear and tear, it's really like you pulled the ligament and it's sore. And it's this one little point and it's really sore. The idea is your body senses the pain through your nerve endings, these pain receptors in your elbow, and it sends the message up to your brain where you sense the pain, right? And that, but if you take these, your cooling and hot heat sensation are pain, forms of pain that same receptor will sense. And if you overload it with a cool sensation or a heat sensation, your body will ignore the signal to the actual pain, the pulled ligament. That's the kind of idea of what these local topical anesthetics do, okay? And as you see here, there's a lot of them, right? Capsaicin, so is Zostrix or Rub A535, right? Salicylates, which the cooling sensation is like Rub A535, Myoflex as well. Menthol, camphor, icy hot patches, all that kind of stuff. Tiger Balm, they all do that same kind of thing, is that they're really causing a low-grade form of pain so your body ignores the sharp pain, right, is what it's doing. Diclofenac's the only one over the counter, Voltaren, that does a little anti-inflammatory as well as that local anesthetic kind of sensation to drown out the pain, okay? So antifungal creams are over the counter particularly are not effective. There's a lot of them, right? You've probably seen all those commercials now that they're doing that awareness campaign. Health Canada is like, it's not a big deal. My toenail, it's like, you know, ew, Dad's got fungus. It's like, it's not a big deal. And then they go accuse the doctor. Yes, it is. It's an infection. It's like, it'll probably go away on its own. Back to the doctor. No, it's not. It can be contagious and pass to your family, right? It's like, and they have a lot of topical, people are cashing in on that. There's a lot of topical treatments. They don't work at all over the counter, right? Some of them are just used for cosmetic purposes. They won't get rid of the fungal infection. It is actually living in your nail, like inside your nail. But here's the tricky part. Even there's a prescription drug that's a lot that, you know, that can be effective, that's topical, right, for antifungal. It's called Jublia, right? But Jublia, in order for it to work, okay, on your fungal nail, this is going to probably drive everyone to not to use it, but it's like, it's only effective if you do this. You need to file your nail down every day, and you need to apply it to your nail every day for 12 months, and then it's still only 15 to 18% effective. So for a whole entire calendar year, you need to file down that fungal nail on your toe or your finger, right? Usually toenail, right? Obviously, because it's you're in socks. That's why you get fungal nail infections in your toes, not usually your fingers. But and it's still only 15 to 18% effective, and that's a prescription drug, right? Over the counters don't work at all. Even prescription, it's very difficult to treat fungal nail infections. Often what you have to do, if you look at this top picture here, is they are even the prescription topicals are 100% not effective if it infects your lunula, okay? And if you wonder what your lunula is, on your fingers, we all have them, it's that little semicircle at the bottom of our fingernail, right? So as you see here, it's this little semicircle here. If the fungal nail infection penetrates that, then all topicals are 0% effective, right? And you have to go to an oral antifungal pill, okay? So, and then here's a couple examples, right? That one there, which levels are you able to treat with antifungal, right, with the topical? Actually, all three of those stages, I wanted to show this too, is going to say, hey, it can't infect the lunula, right? And then you notice here, the stage one, they have the check mark, it has infected lunula. It's all the way down to the base, right? The whole point is the cells that then make the nail are infected with the antifungal, right? Sorry, the fungal infection. So the Candida usually, right? So then you have to take a topical, so it travels from your blood kills the infection at the base of the nail. And then over the next few months, your nail grows out and is killed and not allowing that fungal infection to continue to grow. The issue why fungal nails need to be treated is because as we age and become more immunocompromised, if it's in your root of your nail, you literally have fungus that has access to your bloodstream and it's pumping fungus spores into your blood, which then can attach to organs and cause issues as you become more immunocompromised as we age. So younger individuals, can obviously, your immune system fights them off in your blood, but as we get older, it's something that you definitely need to treat, right? Because it can cause some problems. But then the antifungal, the go-to is terbinafine, which is a prescription oral drug. You probably heard of Lamisil cream. There's a Lamisil pill that you can swallow. And you can take it for 2 to 4 months. Now, a lot of the antifungals upset your liver enzymes. So you have to watch what medications you have because they might change some of those and you have to tweak your doses if you take one of these. But you also have to get blood work because sometimes certain individuals, their liver doesn't like the medication. And you can just tell that from a simple blood test that your liver enzymes, if they spike a little bit, then we might have to switch you off that and try something else, right? There's therapies, but that's the go-to. That's the most effective for treating fungal nail infections. But, obviously there is some risk there with needing to monitor and your other medications you take. That's why Jublia, believe it or not, is the one that I showed there. Even though it's only 15 to 18% effective, that's why often they'll get people to try to treat it for 12 months because sometimes if you're on a lot of medications, that's the for sure safest alternative to not worry about if it's affecting your liver and stuff. So it's very difficult and tricky. But yeah, the main thing is the over-the-counters don't work at all. You need to talk to your doctor and your pharmacist because often you need either one of the topical prescriptions or often likely a more deeper dive into your medications because you might need to switch you on to safer alternatives in order for you to take one of these oral antifungals for multiple months, okay? So then another one, is Voltaren good? I just see a question there. For pain, it does help. Any topicals you guys use, so here's the thing, the difference topical to oral is that, so often, sometimes you can take Voltaren if you're not allowed to take oral and anti-inflammatories. If you take, diclofenac is the name of the drug in Voltaren, right? That is a prescription non-steroidal anti-inflammatory drug. That's an oral pill. But if you take it oral, it goes through your whole body, all over your whole entire body, and that's where it can cause the problems, right? It goes to your stomach, your everything, right? Whereas if you topically put it in an area, some will penetrate the dermis in that area. Very little goes systemic, and it more helps the anti-inflammatory in that actual area. So that's where it's much safer than oral anti-inflammatories, and it does also numb the pain to a little bit. So yes, it's much safer to use than even an oral anti-inflammatory. If you have like upset tongue, often like a pulled ankle or, twisted ankle, this or that, then we have a little bit of swelling. Had a quick, another question here. My experience with Lamisil is that it requires much longer than 2 to 4. Yes. And so that's the thing. It's much more effective than the topicals, but it says here it may not even be effective. Sometimes 4 to 6 months is needed, right? So the research now is saying the 2 to 4, if you do a pulse therapy for antifungals, sometimes that pulse therapy at a high dose, it can reduce how much you need. But toenails infections are, your toenails grow a lot slower than your fingernails. The idea is sometimes it needs 6 months, believe it or not, because it can take your toenails 6 months to grow, right? So that's why it needs a longer therapy. And absolutely, one of the comments in the chat said, sometimes 2 to 4 months is not effective. And that's correct. And that's why you need to be assessed and regular blood work done. And that's why sometimes, they like to go to the topical, even with a much lower, I think the oral pill is closer to 60 to 70% effective. And the thing is, though, if you take it orally and you have multiple toenails, like, shouldn't be sharing this, but I can do it anyways. My father's a physician and all his toes have fungal nail infections, right? All of them, right? Because they spread it all over his one foot and then into his other foot. And we're working on him. He's a little stubborn. He's a 7-year-old physician, And we're at the point where we're going to need to change his meds around because he needs to take oral terbinafine to deal with this now, and not wait until he's like 85 or something like that to deal with it, because it could cause problems for him long term. But the longer he waits, the more difficult it is with drug interactions, and he'll have to do it probably for closer to the 4 to 6 months, right? But it'll help heal all his toenails together, right? Whereas topical, it's one nail at a time, and if you don't get in your toes, and if you don't get them all right, it can come back, right? So that's where the effectiveness. Sometimes you have to take the oral to get it all out in one go, but it's still not perfect, and that's why it's a tricky one, right? So then, as well, I like to bring out here. I get asked this all the time, especially over the counter, because there's also cannabis is available over the counter, right? So I want to make sure people are aware of this. A lot of you see pop-up cannabis over the counter where anyone can buy them, right? They definitely do help, right? For pain and a lot of different things. We talked about Tylenol being the best long-term pain control. Well, you see here, 2018. This started 2018. They figured out that Tylenol, acetaminophen, binds to cannabinoid receptor 1s in the body. There's 4 of them, 1, 2, 3, and 4. And cannabis, what do you think cannabis binds to? Cannabinoids. Binds to cannabinoid receptor 1 and 2 in the body. We're still trying to figure out what 3 and 4 do, but they bind to even more to help in pain-killing action more. The safest drug for pain-killing action out there is Tylenol, that we talked about often. But now they know cannabinoids actually do even better than Tylenol, and they bind to the same system, right? So how do you convince GPs about cannabis? And this is the secret sauce right here. This is why doctors are... So cannabis has a lot of stigma attached to it because of marijuana, right? Like, the old illicit use of it, right? Cannabinoids is not, they're not THC. That is in cannabis as well. And it actually has therapeutic effects. But recreational cannabis use, like smoking it and stuff like that, has crazy amounts of THC. That's what gets people high, right? So let me go to the next slide here. So what's in cannabis? There's 3 main constituents that's in cannabis, right? And this, you can get them in the oils now and the sublingual tablets. That is all purified, amazing. I do not vouch for smoking cannabis at all, right? That is bad for your lungs, right? There's a lot of like tar in actual cannabis itself, right? Like if it's marijuana that you smoke, right? But then there is vaping and stuff like that, but there's still complications with that, right? Through the oral inhaled route. So I recommend oils, right? There's some capsules and stuff like that, but it's now sublingual tablets. The 3 main constituents are THC, which is tetrahydrocannabinol. And what that is, believe it or not, it helps with seizures, pain, inflammation, nausea, painkilling action. High doses of that, that's what is in the recreational stuff. Yes, that's what causes psychoactive high sensation, right? Memory impairment, slower reaction time, and all that. You don't need that much THC. If you see like in doses that help people sleep too, right, for pain, it's instead of the recreational, it's very low THC, mostly the cannabinoids, right? Cannabidiol is the main one, right? Cannabinoids used for glaucoma, insomnia, nausea, pain. But believe it or not now, recent research, until they legalized cannabis, that was the best thing that could have happened, because it was kind of taboo to research a legal drug, right, before. Now they can do it. It's the terpenes that are in cannabis that helps a lot with the pain and inflammation. That's the game changers. And a lot of drug companies are focused now, as you can tell, if they can try to design medications that bind to those cannabinoid receptors in our body even better than cannabis or cannabinoids or terpenes and stuff like that, then they can have the market for painkilling, right? There a lot of people are pumping a lot of money into this going forward, right? So, so that's where things are moving to, and it's a lot of interesting, cool research coming. So the reason why doctors are worried about cannabis, right, is like maybe lack of education. Doctors don't learn much about medications in med school. They learn about diagnosing. Like there's tens of thousands of conditions to learn. So they didn't learn much about even like a lot of the medications. They learn about the top treatments for each one, right? So, and then when it comes to this, the issue that cannabinoids have is that they slow down your liver enzymes. They almost interact with all your liver enzymes, which means most of the medications you take. So what that means is it slows your liver down, just like grapefruit juice, so that your other medications stick around longer, right? So because of that, it makes doctors nervous. If you're on other medications, it might cause your seizure meds, your heart disease meds, your blood pressure meds to stick around. They will cause them to stick around longer. Then what do they do with that if they're not comfortable with that? So that's where you need to have your meds adjusted if you go on cannabis and cannabinoids, right? It's not a big deal. If you have to take warfarin, you have to do the same thing. But that's where pharmacy needs to step up. And right now it's not including. This is over the counter, available on like almost every street corner in certain cities. You can get cannabis now, right? But it needs to involve pharmacy because it interacts with almost all medications. And you're going to tell your doctor, but even more important, your pharmacist, and they need to vouch and help with changing your doses, which usually means lowering your doses, right? And then doing that slowly over time to make sure most people's side effects that they get when they say they take cannabis, right, is actually because of their other medications. If you see here, this is an older adult medication study that there's some of the results on it. It says that cannabis, an older adult study that was done, only 4.9% reported adverse effect of their cannabis after 3 months, right? And that went down to only 1% after 6 months, right? So that even the side effects were low, but they were tolerable. But usually, and here's some other studies that they saw, give me effects that they saw. So they saw a significant 3 to 4, so 74, 3 out of 4 patients had severe improvement with pain, 63% improvement in sleep, 3 out of 4 improvement in quality of life, and then even 59% of them lower prescription costs because they took less medications, right, in this study. Pretty impressive, right, for all that. But the whole point is you need the guidance of, and this is where I see the future of it helping and getting a lot more adoption once pharmacy is more involved, because we need to help make sure doses, we're the ones who know the medications, right? We need to help adjust some of your medications together with you and your doctor, how you're feeling if you go on cannabis, because your doses might likely have to come down in dose a little bit, right? That's the main thing. So if you're dizzy and lightheaded, that's not because of the cannabinoids, because cannabinoids don't really do that. That's because of your other, you might be on heart disease medication now that's sticking around longer and causing you to be dizzy, right? So can you get terpene in the pharmacy? So right now the problem is in pharmacies, we're not included in the cannabis discussion at all. So we had our Prime Minister, Trudeau, unfortunately did a little too much recreational cannabis back in the day. So when he became into power, he got a little too eager. He's like, legalize it for everybody. And he didn't include pharmacy in the discussion. So he didn't think of it on the therapy side because there wasn't as much information on it, that it really, like pharmacy in the future, a lot of European nations have cannabis have to be provided through from the pharmacy because you need that safety check with all your other medications, right? So right now you cannot get any kind of cannabis from the pharmacy. It's all like online partners. And we're actually looking to partner with some online cannabis clinics because I believe so much to help provide drug therapy suggestions and improvements, because we're the clinical pharmacy, right? And the need for that, for pharmacy to rise up to help out in cannabis is huge. But eventually it might all likelihood, they'll have cannabis eventually going through pharmacies because of the severe drug interactions that there are, right? Do you recommend taking cannabis to aid in sleep? So usually not just sleep on itself, right? But I think it helps with sleep and pain absolutely together, right? So the sleep side, like it helps you control your pain, but you know, it's believe it or not, it's the THC part, the very minor part that actually helps make you a little drowsy in low doses and doesn't affect your cognition in higher doses, unless it's in higher doses, right? Obviously. But that's often nighttime doses have a tiny bit of THC in it. It actually helps with pain too more, but it's good for all the above, not just strictly as a sleeping. No, because there's still some, like it's better. There's a lot of other safer alternatives for that particular, right? It doesn't actually, the cannabinoids and the terpenes don't make you drowsy. That's the thing, but they help you with your pain to help you sleep. So if you have pain. So the main important thing here is, you know, consideration. We'll get into the questions too coming up. But yeah, our bodies change, right? Continually throughout our life. Everything changes. So because of that, your meds change too, right? So realistically, if you attended some of our other lectures, it's a quick little synopsis is over-the-counter meds are the same as prescription meds, right? In that they have a positive consequence and a negative consequence if it's in your body. The more meds you have, the more combinations of interactions and side effects and issues that can happen. In Canada, we take a lot of medications, right? It's a worldwide problem now that as we get older, but compliance though for medication use is less than 50% in Canada, right? And a lot of times it's because they don't make us feel good. And it's because we haven't had a lens to make sure to be able to change your doses and change your meds based on you and how you tolerate them, right? Third of all senior hospital visits in Canada are directly due to an older adult, someone over the age 65, taking a medication that is inappropriate and shouldn't be taken for that age group because there's safer, much safer alternatives. Those are called Beers List medications, right? And almost a third, 31.1% of seniors today in Canada are taking one of those every single day. And medication safety studies are often done in a young, this is your kidney function over time. As I told you, kidney function goes down every year of your life. Liver function goes down too, right? Not as much. But medication safety studies are done in young adults, even if they're meant for an older adult, right? So the reason why they do that is because whenever I did a master's degree, I used to do in science, I know you have to control to make sure the effect of the drug is only for that drug. So they often want to do it in individuals who don't have any health conditions or other medications that could throw off the results of the study. But then if you take that dose of the low dose and apply that same dose to an older adult that has 3 to 4 times less kidney function and less liver function, that can be toxic and cause side effects. And then you treat the drug, one drug side effect with another drug side effect, it can cause an issue. And as you notice here, this is the secret sauce that is exciting. BC just approved clinical pharmacy as well. That's what we are. The Health Depot is clinical pharmacy. But, and we need to create, everyone needs to create healthcare teams. As you see here, how can I get my doctor to help suggest cannabis? You need to have a good healthcare team, circle of care. Doctors, they're schooling. I come from a big doctor family. My dad, sister-in-law, cousin, you know, my uncle. They learn 4 years of med school, 4 years of pharmacy school. They learn mostly about diagnosing. Of course, that's what doctors do. But they learn very little about, they don't have time to learn about the medications like pharmacists do. But yeah, when we get out in the community, historically, pen and paper era, right? Doctors have to, there's no way to communicate with other healthcare professionals, right? Pen and paper, we're all not connected. So we call it healthcare siloing. Doctors have had to diagnose you, but then pick what med to give you that they learn very little about in med school, right? Pharmacists need to help communicate. And this is where you see that great collaborative care in a hospital. But the problem is you have to be in a hospital. You have to fall down and break your hip before you get that great collaborative care. Pharmacists, we're going to get a doctor together with a nurse. We need, and a third of Ontarians don't have a family doctor right now. So the ideal healthcare system that we're moving towards, and it's what we're passionate about, that I'm, as you can tell, this is my passionate part with our Health Empowering Your Health webinar series, right? Is that doctors stick to diagnosing, but then, you know, because we even have a doctor shortage, but pharmacists help to make sure it's the right drug for you, based on you. You know, like good example, my dad can't have dairy, right? My mom is allergic to shellfish. My sister can't have almost everything. Gluten, like spices, everything. That's just for food that you eat on a daily basis. Medication is the same way. What works for you doesn't work for me. We have to be able to know, you know, and make tweaks based on what your diagnosis is to make sure it's the right dose and the right drug for you. And that is continually, as your body ages, your kidney function, liver function, your dose shouldn't be the same. It should change over time, right? So anyways, we have access to information now. Health records are exchanged. Pharmacies all can apply for this. It's electronic health records that, you know, that then your pharmacist now can see blood work that you've had done in the hospital or the community. They can see doctor reports, specialist reports. And now we have that information. We can work together with your doctor to help say, hey, we need to lower this dose for this patient because their kidney function is this. We can see it and say, and this is becoming high and causing side effects. We suggest this. And the doctor's like, oh my God, that's amazing, right? Because we're helping to provide that information to them. And we have access to that information now. So what really it is, there's been a problem in healthcare in the past, but now with the tools, it's on pharmacy to rise up and for us to do more to help out. So this is kind of like my analogy I like to say. This is like, I summarize it on this slide. And this is with over-the-counter meds, prescription drugs, you have to know all the sources of what you put in your body, right? So you have different doctors, right? A lot of people sometimes with specialists, they'll have 5 or 6 different doctors, right? Who don't talk to each other. And don't get me wrong, doctors may not learn in med school much about medications, but your cardiologist, Dr. Hart, he has to pass an exam so he knows the heart medications really well. Yes, your cardiologist will know the heart medication. Your neurologist, Dr. Brain, will know the brain medication because that's what they do to pass their exam to be a specialist. But the problem is they don't know each other's meds, right? The only one who knows all about the medications are your that see them all too is your pharmacist. It's got to be on Pharmacy Now to use these tools to advocate for you, work together with you in your circle of care, right? Doctors, pharmacists, keep the communication going to then reach out to Dr. Hart and say, hey, we need to lower this medication because the patient's kidney functions this, but also Dr. Brain put them on this medication. This is interacting. So we suggest switching to this one. And then the doctor's like, oh my God, that's amazing. But because they know their meds, but they don't know even what you're taking, or they don't know about the other meds. So that's the future in healthcare. And that's what clinical pharmacy is. And that's what we're really passionate about at the Health Depot. And it's really exciting. I just found out today that so Ontario, we're a little behind, right? We're a clinical pharmacy. We're now a part of a nonprofit organization, Green Shield. We're growing right across the country. We're going to be opening up a location in BC, and BC government has just approved clinical pharmacy trial to try to get this ingrained in out for $23 million pilot project to try to make it so like pharmacists are like doctors kind of out in BC, making sure we help personalize meds for you, making sure it's the right dose and everything. And that like finally a government, besides all these healthcare organizations screaming it for years, which we're trying to do, the government's actually putting they're fully supporting, trying to make it so the future in healthcare, just so you understand, is that your doctor diagnoses you. If you have diabetes and heart disease, right, you have that unfortunately until the day you die, right? But then once you have that, your doctor follows up to make sure that your diagnosis and stuff like that is not progressing or other problems are happening. But then your pharmacist helps to make sure it's the right med for you. And we help tweak to make sure your blood sugar is maintained or your blood pressure is maintained. That's the future in healthcare, which is exciting. As you can tell, I'm just a little passionate. I apologize. I always throw this at the end because this is the direction where the future pharmacy is going, not just your pharmacist going red pill, blue pill, white pill, red pill, blue pill. That like counting pills is not why we went to school for, right? There's so much more we can do to help. So having said that, if you guys have questions too, we've really pushed, and I want to share this. So we don't have it on our main webpage, and I apologize, but we're the preferred pharmacy for CARP, is one of the organizations we're working with for Canadian Association of Retired People. We're their pharmacy page. You can book a free consult with their clinical pharmacist to go over any over-the-counter, your prescription meds anytime. They see his book now button. It takes you to a new landing page here at the Health Depot where people can book. You can call too, obviously, and book a consultation, but you can book a time to speak with their clinical pharmacist right off here, right? What we're doing is we're hiring a lot more clinical pharmacists to go one-on-one, talking and making recommendations about your health, right? That, we have access to get access to our blood work, you have to be a patient of our pharmacy. But what you can do is you can always email it to us. We can make a recommendation for you. But the whole point is, yeah, you can book a consult right here at different times to talk to our team, and we can make suggestions right there. I have Green Shield, being a nonprofit organization founded by pharmacists. They're supporting us, really helping to improve people's health. This whole model of clinical pharmacy we see as the future is that we're going to be kind of like doctors it should be pharmacists helping to make sure and listening to you and your issue and working together with the diagnosis with the doctor as a team to get your therapy and your treatment, which involves over-the-counter, prescription, cannabis, right? But you have to look at the whole pie because they all integrate. And like we just told you, even with cannabinoids too, right? For pain and sleep, it can muck up your other meds. You have to look at it together and make adjustments, right? So absolutely. So having said that, we should get back to the questions. So where am I here? Let me just move this here. Sorry, just wanted to share that. And I would love to hear about what kind of questions. So this is how you can contact us or email us to set up an appointment. On our main page, we'll have a book consult button there soon. We just haven't built that yet. I apologize. So I just had to show you it's coming. But I mean, this is why I became a pharmacist in the first place, right? It's trying to help improve people. I did not become a pharmacist, sit in a pharmacy and go red pill, blue pill, white pill over and over again all day long on assembly line. I came here to help solve people's problems and to try to, help individualize. And they talked about in school, that less than 50% of Canadians take their drugs and as prescribed by their doctor. And it's because we're not listening and we're not helping to change to make sure it's one that will work for you, right? And that's what we need to do. In order, they said, you need to tell your patients to take their pills. Like I can't, with Darlene, like I can see her face right now. I can't go to her house and say, take this pill, like, why I'm watching you, it's like, that doesn't work. There's a reason why someone's not taking their pill, right? We need to discuss that and then find a better solution, right, for you that works for you and you don't feel bad, like blood pressure pills. If you feel like you're going to fall over on your face every time you take it, you're not going to take it because you don't notice your blood pressure. But you sure as hell notice if you're dizzy all the time, you stand up and you're going to fall over, right? So we need to adjust and make sure it's the right one for you. So I have some questions here now. I'm starting to see. So let me just try to, maybe I'll stop sharing here. And so,
do you need help wading through them, Andy? I've been trying to keep track
I'd be
here.
helpful. Yeah.
Okay.
Yeah.
So I have one from Joyce. I think you may have covered it about your GP and cannabis, but should you go to a specific clinic? And then what about traveling to the US, being that it's illegal?
Yeah. So that's where getting it's going to help out, right? So you need to, wherever you're traveling, you need to have documentation. So you need to, if you're going to travel, you definitely need to get a prescription from your doctor, right? Okay. Or there's medical clinic, like pain clinics and stuff like that. Sometimes if your doctor's not supportive, you be honest, that's where like pharmacies really need to step up and help advocate why it's important. But then, it sucks because you don't have a prescription label on it, right? Because pharmacies are not included. But you'd have to find out where you're going. Different states, even in the United States, have different rules, right? Obviously, some allow, but it's crossing the border too, right? You have to have all your medical documentation with you regardless where you go. You have to be very, very careful, knowing where you're going, what their thoughts are on cannabis, right? And cannabinoids, right? Even like the oils, and have all the proper documentation with you. But you'd have to call ahead, and you'd have to call like where you're crossing the border, what the rules are to know that. Eventually, that'll help a lot if pharmacy can do it, because you're allowed to go over the border with narcotics if it's in a bottle, right? With a prescription bottle, and you have the right paperwork, but because pharmacy is not involved right now, it's a little trickier. And that's why getting that prescription from your doctor and that proof, that's going to be a bare minimum, but it depends on where you're going. Each state and each country has their own regulations. You'd have to check. For sure.
Thanks, Andy. I'm not going to say this right, maybe, but Pat would like to know, can you get terpene in pharmacy? Terpene. No,
yeah, I think I saw that question. Unfortunately, you can't, because again, we can't provide any kind of cannabis in pharmacies yet. In the sense we're not approved dispensers of cannabis yet. They're working on that. Apparently it was gonna probably happen like a year or so ago if it wasn't for the pandemic. It's coming. But terpenes are like, they're often mixed in cannabinoid oils, and the right company or test strips, sublingual test strips as well. There's a bunch of companies that we're trying to figure out how we can help support, because I think, because we can help adjust meds for people, right? But we're not involved with the meds. They have to go directly to you. But yeah, terpenes with cannabinoids come hand in hand. And you usually get them from licensed producers shipping them directly to you.
Okay. Same person asked, just to clarify, if you are taking significant Tylenol 3 for pain, you should take Senecot rather than Metamucil for regularity. Is that correct?
So yes, Senecot, if you find like, like as I mentioned before, Senecot, like if you're having a lot of really bad problems with constipation, if you do regularly take that, Senecot's the one that helps with the narcotic constipation. Yes. Your body converts codeine into morphine, believe it or not. That's how it works for painkilling action. But they're both binding your gut to slow your gut down. So Senecot's the one that helps the best with that. Whereas you won't notice much of a benefit from the Metamucil as much. And like, as I mentioned before, depending on how much you drink and whatnot, it actually can cause problems if your gut's not moving. It can actually make it more compact over time.
Okay. And Margaret would like to know, do gluten cutters work?
You got me there. What's a gluten cutter? Sorry, that's not a cutting device? Or sorry, you mean diets that cut back on gluten?
Yeah, I guess it's.
Yeah,
Margaret,
okay.
do you want to unmute there?
Yeah, it's it's a pill if you have problems with gluten. It's got a bunch of digestive aids and other stuff that I didn't know what it was. And it's supposed to help process the gluten in your body if you're not having celiac, just having some histamine problems.
Yeah, there's a lot of enzymes. So if your body, it depends. You'd have to know if your body's not making enough enzymes. There's like amylases. Yes, there's a lot of like enzymes you can take, like a concoction. They can help for sure. If your body doesn't have enough of those pancreatic enzymes, is what they are. Like my mother-in-law had her, for instance, she had pancreatic cancer, and they resection and cut out most of her pancreas, right, as a part of the treatment. And because of that, she always has to take a concoction of pancreatic enzymes multiple times a day, right, to help cut up her food. So if you're having issues and it's because your body's not cutting up, you'd have to know if that was the problem, right? But if your body is not able to cut up gluten as much, and that's the issue, then taking like one of those for sure can help. But it's like specific to, whereas if your body does make enough of it, it won't really help, right? So it's that's not going to be the issue. So it's you take something if that is a known problem for you, then for sure, yeah. And there is good concoctions of those enzymes, right? Like depends on what your issue is. And for someone like, if you're missing half of your pancreas, then, you need a concoction of all the above kind of thing. So it's like a big mixture of these enzymes. Yeah.
Thank you.
Absolutely.
Thank you. I have two more questions here.
Sure.
Margaret would like to know, how do you get your doctor and pharmacy to join Clinical Connect?
Yes. So Clinical Connect is tricky. So there's Clinical Connect and Connect in Ontario are different areas in Ontario. Okay, kind of confusing, right? But it's depending on what region you live in. You guys are in Toronto, is that correct?
We're in Oakville, Burlington, Mississauga, Milton. So we're part of Halton.
Yes. So I believe most of your region, like Hamilton is, and just east of Hamilton, Mississauga might be partly in Clinical Connect, whereas Connect in Ontario, same thing, different set, like it's the same e-health network. They have to apply and they have to have a privacy. They just have to feel the need to want to have access to health records to improve people's health, right? It has to be a focus. It's a lot of work to get, but it's amazing once you get it. And I'm trying to even help advocate that I think our profession really needs to step up and all get it. Your doctor as well, right? It helps them get access to health records. They have that already in hospitals, but in the community, it allows you to have a lot better access. It's that's a tricky one because you can't force them to. You just want to try to encourage and say, I would love it if you could. It's because it gives more of that health knowledge, right? That they can, it helps them to collaborate more. There's collaborative tools too that, for instance, Prescribe It, that connects doctors' systems with pharmacy systems. So we text message each other from our own software, right? That's another tool that makes it very easy to communicate doctors and pharmacists, right? That we have as well. And you have to apply for that. It's just trying to show them how it makes things easier and more collaborative, like they're right next to you instead of through fax and stuff like that. It's a lot easier to communicate. I'm actually I'm the ambassador for Prescriber for Pharmacy for All Canada, actually. And I really believe in that. That's a communication tool between doctors and pharmacists that over 5,000 doctors in Ontario have. But it's just trying to encourage doctors to adopt new technology that helps improve your health. It's definitely great to mention to them. We're hopefully going to make it easier for these to sign up and to be more implemented into their health, their programs themselves going forward. And so I'm trying to work on them to try to include that in the doctor's software itself, right? Absolutely.
That same person that asked that question, Margaret Kerwin's asking, is what is the Clinical Connect website that she could send her doctor to? Is there an official website or?
Yes. So I could actually, I'm going to look that up in the background in 2 seconds, right? So if you look at Clinical Connect, so this is just the eHealth database, right? Clinicalconnect.ca, right? Is the website. So if I even share here, I'm just gonna click right here. Share button again. So I just went to it. There we go, Clinical Connect, right? So that's like their website. So that's for Southwestern Ontario, right? It is actually Hamilton Health Sciences Center. That's the main hub for that. But then if we go to Connecting Ontario, it's the same kind of thing, eHealth viewer, right? So this is right off of eHealth Ontario's website, right? So if you just type that in, it's all like your lab results, drug filling history, doctor's reports, specialist reports. It's a better tool of making sure collaboration in healthcare, right? That you can get a lot more, you have access to all the information to make sure that we're helping to make the right decision towards, you know, and everyone can see the same information towards your health, right? Because we need to progress to very, very important. And they're screaming at, there's a lot of nonprofit organizations that their whole purpose is that we need to collaborate more. We all have our strengths. We need to work together in the circle of care to make sure you're getting the best quality care all overall, right? And that's where these kind of tools help facilitate that a lot better, for sure.
Awesome. And Joyce would like to know if the hospitals use Senecot when using morphine.
Often I believe they do. I would have to, it depends on which hospital and which physician, right? So it's just that docusate sodium is lacking efficacy for helping out in that way. And it's not shown to do much benefit, whereas Senecot is the more go-to. So each physician they have their own prescribing habits, right? So you'd have to, it would be more on an individualized basis, right? They should be using it, because a lot of people, and there's a lot of advocacy groups that say, like, it's like, if you're using a narcotic, it's not a matter if, it's a matter of when you will have constipation because of that, right? That is, it should happen. And then when that happens, the treatment is some care, if you're getting it, they prophylactically give it to you, even if you haven't had constipation yet, because they know you're going to get it, they might give you the Senecot with it right away.
Okay, and then our final question before we wrap up for today is, are you aware of the Shoppers Drug Mart cannabis clinic?
Yes, there's a Shoppers Drug Mart, there's Aurora, there's a lot of ones out there. So that's not affiliated actually with Shoppers Drug Mart pharmacies. It's like, because they're not allowed to, it's owned by Shoppers Drug Mart, and they do have, so that then they would ship you the cannabis right to your home. Like, so that's one program. And then there's like Aurora, there's a bunch of other ones out there as well that are very reputable. And there's special clinics like Light Medical, LYTE. There's a lot of different ones. If you guys wanted to reach out, I can definitely suggest some others as well that actually have doctors. I think Shoppers Drug Mart is more on the distribution side than the actual having a doctor talk to you clinic side, right? There's a lot of doctor clinics that just focus on that know, and they can kind of, right. But again, I caution, like, so a lot of times they'll do that, but you need to have the whole lens to make sure that they work together with your doctor and your pharmacy, you know, once you get that, to see what kind of changes you might have to have for your medications, right? So that's very important.
Okay, sorry, I do have one more question. Ruth, I see you there.
Sure.
Thank you. Two things. First of all, if there's time, you didn't comment on Gaviscon and reflux.
Yes. Okay. So do you have any questions? Yeah, there's too many topics to talk about, so I focused on a lot of them. Gaviscon is alginate, right? It kind of coats your stomach, so you don't feel the burn, right? So it kind of coats it and protects it, so the acid doesn't cause a burning sensation. So it's definitely effective for doing that. It doesn't stop your acid, your sensation. The issue with antacids too, yeah, that's another topic. There's so many topics to talk about. So you have these openings, right, going into your stomach. You have an open sphincter. They're called sphincters. They're supposed to close inside your stomach and outside your stomach, right? You have them all over your body, believe it or not. But what happens, why you get heartburn and whatnot, is because the opening at the top of your stomach doesn't fully close. Okay, the mass in your stomach can go up your throat and cause burning sensation in your esophagus. And then often one of the most common problems that when patients come and counsel is I ask them, you know, like, is if you lie down horizontal, some people cough a lot the next morning, or they wake up coughing, or almost like dry heaving, vomiting, right? That's what happens if you have acid reflux. And, you know, so when you lie down horizontal, flat, acid can go actually up your stomach, up into your throat area. And you have these pH centers in the back of your throat that sense the pH drop and will cause you to cough. Because if they didn't, that's a good thing. What would happen is if you aspirate your acid from your stomach and it gets into your lungs, it'll shred your lungs. It'll just help destroy your lungs. It's not good for you, right? So it's actually protective. So what a lot of people have to do for that is prop themselves up with pillows so they're not fully horizontal, or prop up their bed. This is a common problem with a lot of people, individuals. Sleeping on your right shoulder helps, right? Not your left. Because believe it or not, your stomach goes down, anatomy, down into the right. So if you sleep on your right shoulder, you know, that little shoehorn at the bottom of your stomach keeps the acid down there and it doesn't go up your throat as much, right? So little tricks like that can help out a lot. But believe it or not, antacid pills long-term are not great for you. That's one of the, believe it or not, they're one of the Beers List meds. You should only be using them short-term because they can cause, they lower, there's a lot of risk, believe it or not, even for your kidneys long-term. If you take them way too long, they can stop you absorbing calcium and iron in your diet. Bacteria and stuff can get through, right? So it's meant there for short-term issues. Having said that, I myself have acid reflux problems. And I find that I have to cycle on them, cycle off them, depends on the time of year, right? It's all about comfort. But there's a lot of those lifestyle learning, you know, don't eat 2 hours before bed, don't drink fluid an hour before bed, spicy foods, so like all that kind of stuff you have to change and adapt to. Whereas the over-the-counter antacid pills are horrible. They're not good for you compared to if you're gonna need a pill to help out reduce the acid in your stomach, it's not fixing the problem. The acid will still go up your throat. It's just like turning down the, you know, you probably heard of simvastatin, atorvastatin. Those are the statins, right? Sorry, sorry, the wrong one. Pantoprazole, azole, sorry, it's wrong class. Pantoprazole, esomeprazole, all those ones, rabiprazole. Those ones will turn down your acid about 90%, but they won't fully fix the problem. It's just a temporary relief. But it's not meant to be taken for like 20 years. So that's the thing. So some of those lifestyle changes you need to do is very important for sure.
And the second thing was just quickly an idea for you. I got into an anthill gardening and I got 25 insect bites. So I came in and I took an antihistamine and then I put some cortisone cream, Life Brand, on me. And I'm thinking this would make a great topic. What does your pharmacist recommend you keep in your medicine cabinet? Because these are things I did right away and they seem to have been the right thing to do.
You got it. So antihistamines help you if you have an allergic reaction, right? But the magic sauce there is the steroid, the hydrocortisone cream, right? That's a very good one to have on hand and use. Just be careful, right? To not use it too much. But like situations like that, that'll reduce your body's swelling. It's any kind of swelling, right? Mm-hmm. And usually when you get bites, that's what causes you to be itchy and irritated is because your skin becomes red and swollen, right? The cells do. So that's why that helps out right away. Absolutely.
Thank you.
No problem. Absolutely.
Thank you so much, Andy. Darlene, I'll hand it over to you.
Andy, you are a marvel again. We are so fortunate. Thank you so much. God, your knowledge is just so amazing. I'm sure there's 1,000 other questions that people have. You just never run out of things that you know.
No, definitely happy to thanks for having me again. Definitely, this is like the reason why a lot of us become pharmacists and we want to help out, right? It's just making sure people are aware. There's that's a very important resource to use, and absolutely, it's a pleasure. Glad to help for sure.
Well, thank you so much. It's our third one, as you said. You did your first one on Sleep 101, and then you did it on pain medication, and they were really fantastic. But I really think this was your best. You get better and better.
Well, thanks. I appreciate that.
And I'm really pleased that your Clinical Connect is working so well. I truly believe that is the way of the future. The doctors have to start working with the pharmacists. So I hope you can get more and more groups involved in this. And we can certainly help promote that as well, being an advocacy group.
No, that's amazing. Yeah, absolutely. And appreciate that. There's so much excitement. I can't believe, for a long time, I was keeping that quiet with the early days. I was talking with you guys, right? Was the fact that transition to being a nonprofit, like being a part of the nonprofit organization happened just over a month and a bit ago now. And that's why I haven't had a talk in a while. That happened at the end of April, just now. And I've had that quiet for it was a lot of work. But now part of that, which is exciting because now we can really help. It's very tough. The way I saw our profession, right, is that they pay us to, this is what's the problem. And you don't knock your pharmacy if they're not, like, this is like, we're trying to guide the road, is because they only pay pharmacists based on how many pills they send out the door, right?
Yeah.
It's like, so that's why certain companies, and the larger they are, the larger the organization, why they do red pill, blue pill, white pill, and they just try to get as many out the door. They don't counsel people, because that's how we're being paid right now. We need to change that long term in order to create this collaborative model. They are increasing pharmacist usage in the sense of minor ailments prescribing coming up, believe it or not. That's been approved. And there's a lot more going forward. We're hoping that we'll be able to then have pharmacists being kind of like doctors are, in the sense that you can bill for a lot more consultations and helping out to make sure to take you off meds and put you on, make more of those decisions long term. And it's allowing us to do a lot more of those actions to try to prove the need and the usefulness of that before, I guess, they really fund it for everybody, right? So that's, it's very happy about that partnership, because it allows us to do this. As you can sense, I'm always a little bit over passionate about this side of, very bullish on what pharmacy can do to help it long term.
Yeah, no, I think, and that's what makes you so interesting to listen to, because you are passionate about it, because it could be a pretty dull topic. But your passion is just, it's amazing. Anyway, thank you, Andy. Really, the SWAG group, just can't thank you enough. And we certainly will help and advocate for this.
Thank you very much. All the best.
Thank you. Thank you to everybody for joining us. I hope you enjoyed it as much as we did. Thank you.